What if I told you that Tirzepatide and Semaglutide could lower your risk for dying from a cancer? Would you believe it? What if I told you that the experts believe that Retatrutide could do the same? In fact, many experts believe that Retatrutide will work even better than Tirzepatide when it comes to lowering your risk for dying from cancer. And I don't make this stuff up, folks. This is all based upon a huge, massive study that was just published in the prestigious journal, the Annals of Oncology. And in this study, folks, the study researchers enrolled over 229,000 patients into the study to see if GLP-1 medications, specifically semaglutide and tirzepatide, could lower the risks of these people, these patients, getting cancer. And this study is even a little more special because they did not study diabetics. They studied obese patients who were using GLP-1s to lose weight. And what the researchers found, folks, with the study is just absolutely incredible. In fact, the people that took semaglutide and tirzepatide didn't just lose weight, folks. What they found was that these patients had a 41% drop in their risk for getting cancer. Yes, you heard me correctly. They had a 41% drop in the risk for getting obesity-related cancers. And of the two peptides, semaglutide and tirzepatide, tirzepatide was shown to be way better than semaglutide. And folks, why is that? Well, because semaglutide works at one receptor, the GLP-1 receptor, and tirzepatide works at two receptors, the GLP-1 and the GIP receptor. But oh, there is more. Many experts, and even myself, we believe that Retatrutide will have even a better benefit when it comes to lowering your risk for dying from a cancer. And why is that? Because Retatrutide works at the GLP-1 and the GIP receptor, but it also works at the glucagon receptor. And we're going to touch upon that more towards the end of the video. So if you want to hear the amazing things that Retatrutide can do, follow me closely. Now, as a physician, I can tell you, and I am a physician, I'm a Mayo Clinic trained family physician, so keep that in mind. But also remember, folks, I am not your physician. Everything here is for education and entertainment only. So enjoy the video, but don't take any of this as medical advice. If you need medical advice, please see your doctor. So folks, what impresses me most about this study, which was done at Houston Methodist in Texas, and it was led by Dr. Aparna Kamat, what impresses me most about this study is they looked at patients who were not diabetics. Diabetics normally are more at risk for cancer and heart disease and stroke and various things because their system, especially the insulin resistance that they suffer from, causes cellular damage, and the cellular damage leads to problems, okay? And that's why diabetics typically will get more diseases than non-diabetics. But what I loved about this study is this study wasn't, again, performed on diabetics. The study was done using healthy people who were simply obese. And many of the patients in the study were not very old. In fact, the average age for the study was just 47. So in some respects, this study more closely mirrored the general population than a study would have if it were studying diabetics. And the results are just absolutely incredible, folks, just absolutely incredible. Now, if you don't know it, folks, there are certain cancers that obese people get, and these are called obesity-related cancers. And there's about 13 different malignancies that are related to obesity, but some of the most common ones are endometrial cancer, colorectal cancer, breast cancer, kidney cancers, liver cancers, and a few others. But if you are obese, you already are more at risk for cancer than a non-obese person. So again, this just gets back to losing weight and to getting the body healthier. But this study was very impressive, for it showed that nearly 70% of the men in the study who were taking tirzepatide saw a drop in their overall cancer incidence. Folks, that means if you had 100 men in the study, 70 of those 100 had a lesser chance of getting cancer because they were on tirzepatide or semaglutide. And that is very impressive, folks. In fact, I can't remember seeing data like this ever in my career. And I've practiced medicine for for 30 years. As I said, I'm a Mayo Clinic trained family physician. I do longevity medicine. I do wellness medicine. I do weight loss medicine. I'm a big fan of peptides. I am into longevity and I am into wellness. But I cannot remember when I last saw a medication, specifically a medication for diabetes or weight loss, that did these amazing things. And amazing it was, obviously for men, a 70% drop in the overall cancer incidence, but it was also impressive for women. Women saw a 58% reduction in endometrial cancer and some other malignancies. And these types of cancers can be very aggressive, folks, and a lot of folks die from these every year. So if you can lose weight and you can do that while using a GLP-1 medication, semaglutide or tirzepatide, these medicines will help you to live longer. Now, if you've missed my other videos on why these medicines lower your risk for stroke, heart attack, cognitive decline, dementia, Alzheimer's, sleep apnea, diabetes, you name it, you should check those out. At the end of the video, there'll be links to some of my other videos so you can learn more about tirzepatide, semaglutide, and retatrutide. So when these two medicines, Ozempic and tirzepatide, were compared, it was very clear that tirzepatide users benefited the most. They had the highest reduction in cancer risk. They had the highest reduction in cancer incidence when compared to semaglutide. And many experts again believe that we shall see the same thing with retatrutide. And why is that? Well, because retatrutide works at the same receptors as tirzepatide, but it also activates the glucagon receptor. And what happens when you activate the glucagon receptor? Well, it's simple, folks. Your body gets healthier. And a healthier body has a healthier immune system and it has healthier cells. And if your cells and your immune system are healthier, then your body will better be able to deal with a cancer when it occurs. Many experts believe that we spontaneously develop cancers all of the time, but your immune system takes care of them so they don't develop into something bad, okay? And they go away. You get into trouble when your body loses the ability to beat down the cancer, and then the cancer proliferates and causes problems and can ultimately lead to death. So by getting your body into a better state of health with tirzepatide, semaglutide, or retatrutide, you are lowering your risk for cancer. And glucagon, when activated by retatrutide, does some other very special things. What it does is it also helps your body to clear intrahepatic fat, that's fat in your liver, and visceral fat. And the data is very clear. If you have more visceral fat, if you have more fat in your liver, we call that fatty liver disease, that puts you at risk for malignancy. Plus, when your blood sugar is high, you are more at risk for malignancy. Why is that? Well, because tumors, cancers, bad things that are growing in your body require excess glucose to grow. And if you limit the glucose that's available, if you decrease insulin resistance using these peptides, but then you will make the cells healthier and you will starve the tumors of the glucose they need. So by decreasing glucose overall, malignant cells will not have the glucose they need to proliferate, and that will help your immune system to keep those under control. So that is how retatrutide can do a little extra when compared to tirzepatide and semaglutide. And visceral fat, folks, if you're new to my channel, by the way, hit the like button and subscribe. But if you're also new to my channel, then you need to know that I hate visceral fat. Okay, visceral fat is the fat around your organs. It's the fat that gets into your liver, and it is just bad for us, okay? And all of the data is clear. If you want to live longer, if you want to be healthier, you have to get rid of it. And here again in today's video, I have shown you that these peptides, the GLP-1 medications, they are longevity meds. I say it all the time. Everybody looks at these as diabetic meds or weight loss meds, but they are those things, but they are also longevity meds because by resetting your body to a healthier state, by getting your cells healthy, by activating your body's ability to properly regulate glucose and to be less resistant to insulin. They make your cells healthier, your immune system healthier, and because of that, you will live longer. So folks, if you're brand new, again, hit the like button and subscribe. I'll be back at you soon with another video. I appreciate you and have a good day. Bye.